The secret sadness of pregnancy with depression. Depression is one of the most common pregnancy concerns, but it has remained underground over these years. The myth that the pregnant woman must be happy is still prevalent. And because of that, a woman often feels ashamed to bring out the real feelings about her pregnancy. She tends to hide it and keep it to herself, thus worsening the problem. Nobody has acknowledged how appropriately anxiety-ridden pregnancy is, how traumatic the change in identity that accompanies prospective motherhood can be. It becomes difficult when each woman has to invent this new identity for herself. It is during the pregnancy when she tries to understand who she will be when, as is sometimes said, a piece of her heart lives outside her body. Many women experience angst about the persistent admonition to expectant parents that nothing is ever going to be the same. Some imagine this vaunted change as a sentence of doom. These troubling feelings are common among pregnant women. But for those with antenatal depression, they come to loom large, casting a shadow over all the positive aspects of expectancy. A key point to note is that if a woman has depression before, she is more likely to undergo depression during pregnancy. The facts state that 1 in 7 women are treated for depression at some point in time between the year before pregnancy and the year after pregnancy. Antenatal depression, depression suffered during pregnancy, affects up to 15% of expectant women, and it can be traumatic for not only the expecting mother but also for the child. How can it affect your baby? If a woman is pregnant and if her depression is not treated in time, you are more prone to have 1. A premature childbirth. A premature childbirth means that the mother delivers the baby much before the actual due date of the childbirth. The actual duration of pregnancy is close to 37 weeks, but in the case where the woman suffers from depression, this duration is reduced and the baby is born a few weeks before. In such cases, the baby is weak, unhealthy and at a high risk of respiratory problems like apnea, respiratory distress syndrome, RDS. The baby is also prone to other health problems like anemia, jaundice, cardiac defects, etc. 2. An underweight baby. A pregnancy intertwined with depression often leads to the delivery of an underweight baby. The normal weight of a baby when it is born is 5 pounds, 8 ounces. But in this case, where the mother has been depressed during the course of her pregnancy, the normal weight of the baby is not maintained. Apart from the above, the baby is more irritable, less active, less attentive and has fewer facial expressions than babies born to mothers who don't have depression during pregnancy. How does it affect the expecting mother? 1. Higher risk of suicide. 2. Termination of pregnancy. 3. Impaired attachment to the baby. 4. Increased chances of C-section. 5. Higher chances of engagement in damaging behaviors such as drinking, smoking, drug abuse and lack of exercises. Untreated depression or anxiety during pregnancy has been also linked in multiple studies to miscarriage, preeclampsia, preterm birth, and neonatal complications. Antenatal depression is often accompanied by anxiety and obsessive-compulsive symptoms, and sometimes by psychosis. Also, there are cases of depression when the feelings dominate the mind to such an extent that the mother constantly develops thoughts to harm the baby or finding ways to end her life. The suicidal thoughts are intermittent and not long-lasting, but even after the thoughts wipe off, the depression still remains. This is in both the cases of antenatal and postpartum depression. But there is always a right treatment and a right solution. There are many things that can help depressive women: the love of a supportive partner and friends, of course, but also an acknowledgement of their illness and ready access to effective treatment. Pregnant women with depression, especially mild to moderate antenatal depression, can often control it with talk psychotherapies such as cognitive behavioral therapy or interpersonal therapy. Women with agonizing depression who don't respond to other treatments, or who don't have access to them, may take antidepressant medication. Psychological studies prove that the majority of the women who have depression during pregnancy love to be off their medication, as the antidepressants can be dangerous for the baby. Love yourself if you want to love your child.